Good morning. Good morning, everybody. All right, if you could take your seats, get your coffee. We are going to go ahead and get started. My name is Gabby Ochoa. I am the network manager here at the Community Impact Network. Thank you for joining us today. I know that there is a lot on everybody's minds. I think some of us are half here today. And so while we are dealing with a lot today and we want to talk about resources, especially when it comes to SNAP and a lot of the communities then, and all those things that trickle down when those accesses from our government are not accessible, what does that look like? We will have time today to talk about that and network amongst each other about what those resources look like and how we can collaborate or who is already providing those resources. But today and this morning, we are going to specifically talk about the Radiation Exposure Compensation Act, which is a issue that has surrounded North County for such a long time, but now specifically the Community Impact Network, which focuses on the 24-1, is now included in 63121, which is one of our major zip codes that we work when it comes to funding and allocation of resources. And so I'm so excited to welcome these two guest speakers today who have personal experiences with these very specific and tragic issues that's affecting our community, but also are very knowledgeable and have great expertise. The idea for today is that you take this information to your clients who are in these zip codes and you are able to pass that on to them. And if you are personally affected by it, I hope that you also gain some significant knowledge today. After 10 o'clock, we will have a trauma-informed care systems training held by Ms. Christin Simpson. And so that will be likely in that room. If everyone decides to stay, then we can stay here today. Additionally, if you have not received a flu shot and you are interested in receiving a flu shot today, we are going to have flu shots administered in that room as well. By IFM. So thank you, IFM, for supporting us. And I will let everyone know when those start happening. So if you just want to pop in during the presentation and come back, you are more than welcome to. But I will pass it over to these wonderful ladies to introduce themselves and we will continue with the program. Thank you.
Thank you, Gabrielle. Hi, my name is Christin Simpson. I'm a family nurse practitioner. I know I look like I'm 18, but I've been practicing for almost 20 years. I started off really early, knew that I wanted to serve people and care for people. So as a teenager, I worked inside of the hospital as a nurse's aide, student nurse, nurse practitioner, all in the same system. And so I come with a lot of knowledge. I became a nurse practitioner not because I wanted to be close to a doctor, but more so I wanted more autonomy over how I decided to provide care. And I wanted to be able to advocate for my patients without needing to answer to someone else. It's as simple as that, particularly when we know Black and brown communities have so many systemic inequities as it relates to healthcare access and quality of care. And so I transitioned from the hospital back in 2000, but a year after the pandemic. And that's where I found the nonprofit world, which felt more aligned with my purpose, doing community support, being able to give a voice to those who have a voice but need help amplifying that and moving it forward. So I spent about 3 years really digging into trauma-informed care and shaping that with a partnership with Missouri Hospital Association. So trauma-informed care is a lot more well-known in the school systems, but I was contracted to understand what that looks like in healthcare. How do we understand how people show up? And that'll be a part of what I discuss today, should you decide to stay in the other room. And so between that and my current work, I still practice clinically. I work at the Bullet-Related Injury Clinic, with Dr. Punch as the founder. Current executive director is Dr. Jamila Owens-Todd, where we get to do the work that I think healthcare should look like. Low barrier access. We just need the people. We just try to bring the people in. We don't want insurance to be an issue, finances to be an issue, how you show up, what trauma you bring to be an issue. And so I've really been digging deep into that work. I am own my own consulting business, been doing that for a year. It's been beautiful. I also run a nonprofit with my husband called the Village Keepers, where we do a lot of outreach efforts. Some of the people in the room I've met doing that work. And so I'm really an advocate for healthcare. I'm really an advocate for sharing knowledge, teaching people how to advocate for themselves and systems, because the systems will let you believe that you don't have a voice or you don't have rights, and you do. And so I always tell people, write my name down, take a picture of it, use it. If you're in a space where you feel like you're not being heard and you need a name to throw around, and you shouldn't need a name to throw around, but I volunteer mine. So without taking up too much time, my relationship to the conversation today, I am the granddaughter of a grandmother who lost her life to breast cancer. We happen to live in the zone that is impacted by the Radiation Exposure Act. And I'm currently trying to navigate the process of doing applications, getting my family to not be afraid of sharing information. While I don't think that that is a full solution, it is a start of acknowledgement of the harm that happens in community, and that's also related to racial and historical trauma, and I can talk about that later. But I stand here as an advocate in the importance of awareness from a healthcare perspective, how to teach people how to monitor themselves, know their family bloodline, know maybe some environmental factors that could be impacting your communities, and advocate when you can. Oh, you got you.
Good morning, everybody. So I'm not going to do all the talking. I love to interact. I know you guys got to be here, so we're going to be here together, right? So I am Dr. Chantelle Jones. I am the chair of the Community Action Group. It is called the CAG of St. Louis County or North County, where we are actually holding the U.S. Army Corps feet to the fire on the cleanup and the efficiency of the cleanup for North County. So I am honored to be here. I am a two-time breast cancer survivor. I know I look young too. Yes. I lost my mother to breast cancer, my grandfather to pancreatic cancer. Two cousins are breast cancer survivors. My sister tested positive for the gene mutation, where she took the Angelina Jolie approach and did a full hysterectomy and a double mastectomy to decrease her chances. And so I have a cousin who had a rare kidney disease. She died at the early age of 36. A nephew who is still here, thank God, but was diagnosed with a cancerous brain tumor, and all due to this radiation exposure. So the list goes on. And why am I here today? I was elected as the state representative for District 67, which was to give you guys a landmark, which is the Jamestown Mall area. And so coming from a family that was stricken with a lot of illness, I started to do my research prior to me becoming the state rep of North County and regarding Coldwater Creek. And so what we knew was already factual. It became a myth in the community and often swept up under the rug. However, the numbers continue to grow with the abnormalcies or unfamiliar cancers that were growing in North County. And so I became an advocate then, but as I became a legislator, I was able to pass legislation regarding breast cancer patients who, if they were diagnosed by a private provider and they lost their insurance for whatever reason, they would not qualify for Medicaid because there was as they call it, the wrong door policy. And so as a legislator, I was able to create legislation to break down that barrier, giving women who were falling through the cracks and actually dying because they did not have access to care. So diminishing that barrier, where now that no longer exists. So regardless to who you become diagnosed by and you lose your personal insurance, you would be eligible for Medicaid. So I wear many hats in the community. I am also the founder and visionary of the Pink Angels Foundation, which you guys have the pink sheet on your tables. And just so proud to stand before you that to date we've completed and or assisted with 640 applications for RECA. We are a trusted, and I say trusted with emphasis because we already knew that Coldwater Creek existed. And so there is a distrust with our healthcare system and in getting access to care. And so we wanted to be that lifeline again for the community so that they could come in and have their applications completed, reviewed, and then mailed to the Department of Justice. So I would love for you all to be engaged, ask as many questions as you can so that we can get this information out. Now, to date, only 1,300, I'll check the numbers while we're here, 1,300 applications have been submitted, when that is pretty much nothing. When we anticipated over 300,000 people would apply. However, we have families that have moved away trying to get this information that they too qualify. So it is important that we work collaboratively together today to get this information out, and it's not as hard as people may think. It is 24 pages. However, a lot of the pages does not apply to an applicant. All right. So this is a slide it was completed by Just Moms, and which is a collaborative partner with the Pink Angels Foundation. So Just Moms, STL, they are pretty much the lifeline between the community and breaking barriers and breaking down the door of allowing their voice to be heard to get this compensation across the finish line. Next slide. So the RECA is what we call it, RECA, whatever, it doesn't matter. It's the Radiation Exposure Compensation Act. It was signed into law. It's been in law since the 90s. And one key point that I want to point out is that although RECA has been around since the 90s, Missouri is just now getting to the party, which we're not proud about that because Missouri has the largest land exposure in the whole entire country. We have the most affected people, and we also have the most exposure in the land across the nation. So to date, RECA has paid out over $2 billion to other, you may hear the word downwinders. So when the atomic bomb went off, it was the width of the exposure from the bomb that downwinded through the wind into other affected areas. And so you will hear that terminology of downwinders. And so the downwinders were able to apply, and if you go to the DOJ website, this is key, that there is a downwinders application and then there is a Manhattan Project application. The Manhattan Project application is specific to Missouri only, okay? It's specific to Missouri only. Next slide. So in the big, beautiful bill that you guys hear that passed on July 4th, we know that there were some horrible things that were in this bill. However, this legislation, we have tried through several presidential administrations to get this passed over 15 years. And we would get it to the close, and then drop the ball. So we knew that this beautiful bill was going to pass. So we used this bill as a vehicle to get the Radiation Exposure Compensation Act through. And it passed on July 4th. Now, we were told from the DOJ that the application process would not open until December. The application process opened 3 weeks after that. So we did not have any guidelines. We still don't have guidelines. We did not have any processes or any other previous things to go by. So the information that you're receiving now is still what we are continue to communicate until we have access to those guidelines. As you see, this is, I believe, the Westlake landfill. So the Westlake landfill is in Weldon Springs, I believe, and it is a mound of where the atomic bombs actually were made and produced. So you think about the St. Charles area, St. Peter's, you think about O'Fallon, you think about all of those zip codes. And as you can see where the star is, 63044, that is the Westlake landfill. As of today, the bomb material that was created is buried in a mound that people are consistently walking, exercising, field trips, all of the above on this mound at 63044. They covered it. They feel like it's contained. We even have documentation and photos. This Westlake landfill is right, I believe the school is Fort Zumwalt. Say that again.
63044?
Yes. Well, we have pictures of men in moon suits, and right next to the fence are kids playing. So this is the Westlake landfill. These zip codes are covered in RECA. And then we have Coldwater Creek. So Coldwater Creek runs 14 miles throughout North County, starting from 63114 at Overland, and then it goes all the way north to the river. So that's 367 in Lindbergh, to kind of give you an idea. So it starts all the way from Overland, and it goes all the way through all of these communities. So RECA is 21 zip codes, 4 zip codes in St. Charles, 15 zip codes in North County. 15 zip codes in North County. And then we have 2 zip codes that cover Malincrot in St. Louis City. That's why we're sick. 15 zip codes. Next slide. So this is the plant, just to give you all a larger look. So this is Weldon Springs. We have Dardenne Prairie, Cottleville, Harvester, Chesterfield. All of these areas are very close in proximity. Next slide. So this is where the Malincrot workers were here. And as you know, this is kind of the riverfront to give you an idea as to where the zip codes are. Next slide. So what is RECA? So RECA is if you lived, worked, or went to school in any of the impacted zip codes, you may be eligible for $50,000 if you're living, or $25,000 if a loved one has passed away, and that money goes to the next of kin. What we're finding, and we're still trying to get clarification on, example, a lady did not live in any of the 21 zip codes. She worked at United Healthcare in Maryland Heights. We know where that building is. She was diagnosed with breast cancer. She's been there for 25 years. That qualified her for RECA. So if you lived, worked, or went to school, you know, back in the day, 1990s, or they had the DSEG program where children were bused to these schools. They too would qualify, okay? So these are the zip codes, and these are the cancers: multiple myeloma, lymphoma, cancer of the thyroid, breast for both male and female, esophagus, stomach, pharynx, small intestines, pancreas, bile duct, gallbladder, salivary gland, bladder, brain, colon, ovarian, bone, renal, liver, except if cirrhosis or hepatitis is indicated. And for leukemia, you have to have been exposed for 20 years. So that's why you see that. So quite naturally, you would have had to have the radiation exposure for 20 years after becoming diagnosed with leukemia. Any questions so far? Yes. Yeah. Which about leukemia? Yes, ma'am. So if a child was diagnosed with leukemia at the age of 5, they will not qualify because the government has deemed that they have not fit the criteria of being exposed for 20 years. So if a gentleman was diagnosed at 54, he would qualify because he has 20 years of exposure.
And you can just work in one of those
Yes, ma'am.
amount of time.
Yes, ma'am. 2 years prior to the diagnosis. And so 2 years prior to the diagnosis, I'll use myself for example. I was born and raised in Kinloch, Missouri. That automatically qualified me. It's in my lifetime. It doesn't have to be exactly 2 years from the day that I was diagnosed. I've lived in 4 of the zip codes. So each zip code qualified me because I lived in those zip codes in my lifetime. So just keeping that in mind, that even as a child, if someone later on down the line has become diagnosed, it still will qualify them for RECA. Okay? Yes, ma'am.
Greetings. That was a perfect segue into where my next question will land. I'm a breast cancer survivor for years. I've worked in those zip codes and I've lived in those zip codes.
Yes, ma'am.
And initially, when I looked at the paperwork, I didn't see breast cancer, but while I was up retrieving coffee, I heard you mention that.
Yes.
So I want to know, does this apply to me as well?
Yes, if you have 2 years worth of, if you can prove that you were exposed 2 years prior to your diagnosis, you may be eligible. And I say may because we have to be careful of our words. You may be eligible for the compensation. As we continue to talk about the work of the Pink Angels Foundation, 640 applications, 72% of our applications have been breast cancer. It is prevalent. I mean, it is by far 72% of our applications have been for breast cancer, patients or survivors. Then next will be colon or lung.
You can't.
So currently, as we were legislating and fighting for RECA, we had a very extensive list. As you can see, prostate cancer is not on here. For whatever reason, I have no idea why prostate cancer is not on here. Lupus is not on here. Immune deficiency diseases are not on here. And so we had that in the original legislation. But unfortunately, to get it under the radar and get it started, this is the list that the DOJ came up with primarily. This does not mean that nothing can be taken away or added. This legislation will be in place for 2 years, and we will continue to advocate to have the other illnesses added. You get 3 chances to apply. So if you apply now, this legislation sunsets December 31st, 2027. If you apply, which we're looking at 6 to 8 weeks for claims to be processed, the first wave of payments went out yesterday. So you may hear myths that, we're not going to receive payment until after December 31st, 2027. That is a lie. Payments went out yesterday, and so claimants have now been compensated. However, if you apply and it is not covered, you will be denied. If you want to get in place, that's your choice, but you will be denied. So that's 1 strike against your name if you apply and you're not eligible. Prostate cancer patients, they're not listed. However, they feel like it should be on the list. They're going to apply anyway. Well, the way the legislation is written right now, as it is, they wouldn't qualify. So they would be denied. So people feel that they just want to get their place in line, hoping that this change in a year or 2 or 3, and then they will be already in line. Well, that's not the case. This is in place for 2 years. And after 2 years, we're hoping that it be reauthorized. Now, $9 billion have been allocated for RECA again. $7.7 billion of those dollars is allocated for North County. and the surrounding areas. So we have sufficient funds to process and pay out the claims. Two things. If we reach 300,000, what happens is RECA either is reauthorized, it sunsets December 31st, or until all funds are exhausted, right? But as you see, since the 90s, only $2 billion has been allocated. I mean, $2 billion has been funded.
Oh.
So that's not a lot of money.
Where did the 300,000 go to?
So they estimated the people who have passed away, that's a different bucket. And the people who are living is a different bucket. Okay, so our goal is to try to reach the people that have moved away, and also the people here. Don't be discouraged as to applying is not as hard as people think it is. Now, in December, we're going through the paper portion of submitting the applications. In December, the portal will open up. There'll be another set of requirements that we're not familiar with as of date to let people know what's needed and what's not needed. Next slide. So this is a DOJ website. You can go to their website. You can scroll all the way down to the bottom. It'll have RECA claims and you can click on that, and it will show you to date how many applications received, how many applications have been approved, how many been denied, and how many people have been awarded. Next slide. This is the application, and again, I note it says Radiation Exposure Compensation Program Manhattan Project Waste. It is specific to the Manhattan Project. You may be familiar with Pruitt-Igoe, and there's a lot of talk around Pruitt-Igoe and the spray that was done in the community. We don't want to get this mixed up. This is not a part of that, or that is not a part of this. We have documentation that you see, and if you got a packet, this was the earliest documentation that we could prove that the government, in fact, knew that they were poisoning us. Now, we are working in tandem with other advocates for the Pruitt-Igoe. However, this is specific to the Manhattan Project waste. Next slide. You can go to the next slide. I can't see that. Next slide. All right. So these are the resources. We have the Department of Justice, we have Just Moms, and then we also have the Pink Angels Foundation.
Look at the age. Now, I understand the compensation, but what is the government doing to clean and eradicate or?
So the U.S. Army Corps has been cleaning up North County for, I believe, 10 years now. And they have only gotten as far as Cades Cove, which is a neighborhood, if you are familiar with North County, Lindbergh, where the Baskin Robbins is. Okay. But as you can see, it goes all the way up to the river. It goes all the way up to the river. So we are seeing the Pink Angels Foundations, we're seeing 4 generations of sickness. The U.S. Army Corps has told us or communicated to us that it'll be another 40 years before North County is cleaned up. So that's 8 generations of illnesses. Next slide. Exactly. That's it? All right. Any questions? Yes, sir.
Instagram.
We have Facebook, the Pink Angels Foundation. Yes, ma'am.
So when completing the application, especially for family members that are deceased, how do we get access to their health records that are requiring government? How do you access that?
So if you see on the application, it says for if the person is deceased, you would retrieve their death certificate. And on the death certificate, it should state, however, we have ran into some off situations where it was not provided. So on the death certificate, it may state breast cancer or pancreatic cancer on there. If it states on the death certificate, you do not need the medical records. Okay?
And is there any work being done with school districts in those locations to provide the proofs of residency, since this goes back to 1947?
Yes. And everybody is overloaded, right? And we know that we're in tax season for St. Louis County. We know that the senior tax freeze is going on as well. So we are recommending that you use the St. Louis County Library. They have been able to find something on everybody. And so they can certify that document, what they have been using, if it's 1980 or 1975 when our parents or grandparents were living. They have been able to print out the white pages showing that they lived at that address. Absolutely. And so some of the documentation that we can, weigh me down if I'm talking too much. Okay. Some of the documentation that we are working and want to communicate to try that you can retrieve without having to go to the county. Your personal property tax receipts. If you have an occupancy permit, you can go back to Overland or Florissant, any of those places where you were required to have an occupancy permit. If you have old mail that was stamped by the post office, it can't just be a letter, it has to be stamped, that's federal. So we could use that as proof of residency as well. If you have W-2s, that's a federal document as well, we could use that as proof of residence. If you work there, some people are using the work number to verify employment. If the company is no longer in business. Also, the school districts are going back as far as they can to retrieve that information, proving the residence or that the child attended that school.
I have a question with you, but go ahead. And speak for Christian or Dr. Jones, for people who are uninsured or underinsured, where can they start to start seeking access to healthcare if they know they feel something's wrong, but they don't know where to start?
So still at Barnes Jewish Hospital, WashU campus, they will still accept folks for care with or without insurance. Some more private hospitals that are further out in the county prefer that people have private insurance. So I would, we call it Big Barnes down off Kings Highway. However, I will say that there should be, although they may accept you, that doesn't mean that they won't send you a big, beautiful bill when you get home from the hospital. And so a lot of people don't know how to navigate the patient financial services. And so that's part of the advocacy, that the hospital will often have representatives, case managers, social workers come in and kind of tap in. Sometimes they're not very explicit about their role and the ways they can support you. So if you see a representative come in, trying to get you admitted, there's administration people that usually come in once you get into the hospital, and you can say, hey, I have questions about patient financial support because I don't have insurance. And so there's a couple of ways they'll do that. They can assign you both social worker and case manager. Someone will send you a Medicaid application if you're eligible, and they have Medicaid representatives certain times of the week that will help you fill that out, and they will do that while you're admitted. There is a lag time between you submitting the application and you actually getting coverage. Missouri has historically been a state that takes a really long time for people to get coverage. If you get approved, then it's retro, right? From any care that you've gotten from the time you applied, they will cover that, so you can probably hold off on paying those bills and saying, I'm waiting until I get coverage, as long as you communicate those things. If you get denied, unfortunately, the time that you have waited to hear about your process then becomes your responsibility. And so I usually tell people to reach out first to the hospital's patient financial services plan, because they have funds allocated to help patients to do it. They try to make it sound complicated to access, but it is something that's available. When that doesn't pan out, Then I advise people to go to connected community resources to help offset those medical bills. But you're talking about things that are really, really expensive when you're talking about care to this magnitude. Chemo treatments, all of those are expensive by the day. So that is the best advice that I have for uninsured and underinsured. And I think just advocate. There's a lot of organizations, like she was mentioning, that advocate for policies to make sure you qualify for care if you have breast cancer, or there's organizations that make sure that they can help support you with medical billing. And so we can probably discuss and create a directory of trusted partners that I may know that you can advise people to reach out to if they can't afford to pay their medical bills, and we can work on that.
And
I just wanted to add to Christin that specific to breast cancer, there is Show Me Healthy Women. Show Me Healthy Women is you have access pretty much within days. That legislation was also passed to give women access to be able to get coverage for mammograms or ultrasounds or any additional testing that one may need if they have a lump in question. And also, it lasts for 2 years, I believe. Am I right, Christin? 1 year. That's 18 months. It's 18 months. Yes, it's 18 months. And there are nurse navigators and also providers who would help you complete the application if one find a positive diagnosis of breast cancer. And on Tuesday, I had a meeting with the chief officer of Siteman in the current, Dr. Eberline, and the current climate of which we are in now. Siteman made it very clear that they are not going anywhere. The services will still continue as is. Of course, we know that things are ever changing, but from last year to this year, Siteman has done exactly what they have promised. And so to get that reassurance that they are not going anywhere, they will make themselves more visible in the community. And by providing, they're in talks of providing a lung screening van. We also have Health on the Move van. It is a new van that you will see in the community. This van, it does PSAs, it does colorectal exams, and it does not do mammograms because that's separate, but it's coming around so that it can provide that access and tear down the barrier of transportation and other issues one may have.
And I'll quickly add to that. Excellent points. No. I mean, the more we know, the better. Susan B. Coleman is another great resource. They have a lot of funding. I'm not sure all the ways in which you can access it, but I do have some partners I can connect with to learn more. But I know that they have funding to specifically support people who are navigating breast cancer and needing insurance or financial aid. And Siteman, there, from what I know, from when I used to work in hematology, oncology, there is funding on the WashU side as well for patients. And so they have certain resources where if you're under one of their physicians and their social workers gets wrapped into your care, or their case managers, then they will also provide resources for that as well. There is a mammogram bus van sheet that you all have. That's one of the first steps, especially after Dr. Jones just really told us the deep impact. 72% of individuals that submitted application are breast cancer. So screen, because early detection is so important. One of my line sisters, sorority sisters, she's in her 30s, and she's diagnosed with a very, very rare case of breast cancer. And at this, what we consider young, right? And so those, you don't have to have insurance, and they go all different places across the region. What is there right now is their Q4. They put out one every quarter about where they'll be. So they'll usually have their top of the year bus locations. Sometimes toward the end of the year, I'll make sure I am on their listserv. I can share that with Gabriella so she can share it with the community. And I've had people call me. There's also walk-in clinics that do not ask for your insurance information that will screen you. I will also send that list so that can be shared if you have questions. But most importantly, I think especially if you fall within those zip codes or you know people that do, even if you don't feel symptoms, getting screened to know where you are. Some people feel asymptomatic. Some people know right away, I feel a nodule or something, but getting screened is the first step, particularly for Black women because we are disproportionately impacted by this. And so that's just wanting to share that you don't have to have insurance. They have workarounds. That's why they drive into the community and try to find those hard to reach areas to give access for screening. Because once you get screened and they have a test to say you need additional services, you're in their system to kind of walk you through those other opportunities of getting financial aid and support for your care.
Just a minute.
So,
We have a question in the back.
let's go back to reflecting on Dr. Is it Dr. Jones?
Yes, sir. Yes, sir.
Okay, Dr. Jones. That she made that statement about the pro-LIGO. When she talked about the pro-LIGO, I'm not starting off aware of that. Then pretty much considered that project some years ago. But actually, in history, actually, when you think about the project, when they had all the radiation down there and that vomiting chemicals down there, in which she, Dr. Jones, think how it was overlooked, and history says that actually it was really intentionally overlooked during that process, during that time. But actually, during the 1900s, when the majority of the people that from the projects, the Florida down that area, the projects, when they all migrated to North Carolina.
Yes, they did.
And that's why she looked at the numbers and said North Carolina has is so infested with radiation, except she said like 17 to 2 compared. But if you do your research on it, almost all the families moved from the south to the projects, from the projects to North County, and North County got heavily infected with it. And then you see it's like a snowball, then all transfer right to 4 Mile West. That's why they went to Old Fallon and St. Charles. But it all started from there, around there, but it's all detected. That's why North County was so flooded with it down there for so long and still going on. I think they just passed a bill recently about the radiation around all the schools down there. So it's been really actually infected, and it's amazing that you said that because my aunt, which is from Clarksdale, Mississippi, my mom's from Clarksdale, Mississippi, they migrated from Mississippi to the projects, from the projects to Wellston, to Florissant. And my aunt ended up passing away with breast cancer. She'd be able to get 103 years old. And my mom right now is a current cancer survivor, and she's 96. She's been taken with breast cancer at 33 years old. My mom was 96 years old. Is still doing well right today. So some people actually take a blessing, actually they live a long, healthy life, and some people don't make it that far. But if you do your research, it all just like a snowball. It starts from one end and transfer all the way around. And we got all somewhere in our family, somewhere some kind of way, who's all affected with cancer in our family. But it started back in the 18th and 19th century.
Yes. So to your point about, your point about the schools, weigh me down. I'm telling you, it's personal for me. So as I talk about this, I look at our children's children. So just stop me at any point. But if you look at the documentation and you read, we have so much declassified paperwork that have talks of North County, and they are in the documentation, they are literally saying it's not safe. It wasn't safe for commercial, and it's definitely not safe for residential, but they did it anyway. When we talk about Jana Elementary, it's been all over the news that this school closed. Radiation was found on children's tennis shoes. It was found on the playground equipment, the lunchroom, door handles. I believe it was 7 football field worth of dirt was removed from Jana Elementary. It was loaded on a rail car and taken to Idaho, where they are supposedly storing this storing this dirt. And so as they continue to clean up North County, North County levels were actually increased. And you may have radiation exposure on your property, but it may not be to the standards of which the U.S. Army Corps deem you in a remedial area. So we're inviting the community. So we were supposed to have a town hall with the U.S. Army Corps on November 12th, but it has since been scheduled for 2026. They do these twice a year. They've been doing it for years. Seated for 200, and the same 25 of us show up. And so when you hear about the U.S. Army Corps coming, I'm asking, if this doesn't bother you, okay. But if it stirs something within your soul, and if you care about North County, that will be the time to show up.
And I'll just add that what you're talking about is historical environmental trauma. So after the World War II, you're absolutely right. A lot of our African-American population was migrating to city in the Ville and some other cities where the Black population was thriving, but it was getting overcrowded from all the people that were coming from the South. So then you probably have heard the term of white flight. See, when I was growing up, North County was mostly a lot of white families, but then they got picked up and started going further west. And so a lot of the Black population around 1950s, 1960s started to migrate to North County. But that specifically happened because of a lot of housing laws that didn't allow Black families to buy in certain properties. And so when you talk about intentionality and you talk about environmental trauma, people are migrating for freedom, but they're limited in where they could be. The places that are residing are overcrowded. When they go into other areas, other ethnic groups leave, but these are the only areas that they have access to, and they're dangerous, and they were never safe, right? They were never safe. So you're talking about since the 1940s, there's been toxic waste in areas where people are living, but when you target and drive a certain group of people to live in those areas, you know who is going to mostly impact. So when you think about prostate cancer, that I know is not listed, and you think about breast cancer, and you think about other illnesses that mainly impact African Americans, you have to consider the different traumas that coexist in the space that contribute to the health disparities alongside living at or below the poverty line, not having quality access to not just healthcare, education, the job market, and et cetera. All of those play a role in why the health of African Americans deteriorates quicker than other ethnic groups is because of the compounded impacts of trauma that impact their lives as individuals, on top of having toxic waste. Your pipelines, literally this water you bathe in, drink in, cook your food with, has been impacted. Think Flint, essentially, right? They knew that was going on. You looked at the water and it didn't look safe, and yet whose community did it impact the most? So when people like, you pulling a race card, it's always the race card, because we have been disproportionately grouped in certain areas to get less than since we moved here to try to attain freedom, and we're still fighting for free-ish things that we deserve for basic human rights.
And so people ask the question, how did Kinloch, Ferguson, Robertson, Laddie Avenue, how did they get included? And it was the actual trailway, because 70 did not exist. It was the trailway that they brought the biomaterial from Malincrot to the airport. And so that's for 80 years. We're talking 80 years of exposure, 80 years of dirt waste dumped into the water system. And so as it's set at the St. Louis airport in barrels, the barrels rusted, rotted, decayed, leaked, and the government knew it.
That's another one question. I know back here you mentioned they will add an Instagram, right? But when we think about like how important this is, and even what you said as far as like the same 25 people coming out, what ways, and just in general, not just RECA, but like, access to healthcare, can community members in a way be more like champions to get the word out to the people that needs to know this? Like what more can be done. Like, artists, I'm like, how can we do campaigns? How can we, do things that are more like tangible to people? One, so that they understand, and two, that they get involved.
Well, as we talk about RECA, again, it's a distrust. So why show up, right? And as we talk about RECA and coming off of that, now I hate to say it, but now that there's a financial tag on it, we coming out the woodworks, because now I can get 50,000, I can get 25,000. There's really nothing that I could do. The government knew it, so there is a distrust. So as we sit and have these conversations around the table, it's up to each one of you all that are in this room to take this information back and bring some people to this meeting. The U.S. Army Corps, they do not do a great job. I will go on record. They know it. This is my biggest plight with them. They do not do a good job with trying to get this information out, because they when we show up, they have to answer. So the only way that they send this information out is social media, when 90% of our people that are filling out the application are seniors that are not on social media. So we need you to help get the word out, to get people in those seats, so that they tired of my story. My story made it to Capitol Hill umpteen times. They know who Chantelle is, but until they see a family where I had to assist a woman, she did 6 applications. One for herself, one for her husband, her sister-in-law, brother-in-law, her mother, her father. Until they hear those stories, you figure the U.S. Army Corps has been in our community cleaning up for 10 years. And that's as far as you've gotten? That's because they have not been held accountable.
They do a service they can get away.
Yes, ma'am.
And I was going to add to your question. I also am a firm believer of like figuring out where your lane is. Everybody doesn't feel comfortable going into, town halls and speaking publicly. And I don't think that's the only way you can advocate, while it is a very important way of advocacy. I've been to my fair share of town halls. I am the vice chair of the St. Louis Department of Health in the city. And I work very closely with the county as well. And they always have public comment where they'll have people virtually or in person where you can voice some opinions of your concerns and how certain money is being spent as it relates to public health. The county, imagine, does the same thing. So if sometimes when we can't be present, we get a group of us, like as a board or as a group or as an organization or as a community impact network, and write a collective letter and submit it and ask it to be read for the record, so that on the document it says this group of 60 signatures, 60 people have collectively said they agree with the writings in this. And that can also be a representation of you. You can call your legislators, get to know your elder people, get to know who your reps are. And I know not everybody is personal, but people like Dr. Jones that can show you like, okay, here's who somebody else you can talk to when there's policy changes, when there's voting that happens. Really think about who you're putting in office and how they care about your community. And she made a really, really good point about now that there's finances attached to it, we coming out the woodworks. And it disheartens me. I have a love-hate relationship with paying people for their trauma, because it's not enough. When lives are lost and health, I can't get your health back to where it was. We're grateful for the people that survived, but they have their own trauma to live through those experiences. And when you are talking about a group of people that have continued to be marginalized, that are basically fighting for their own survival, money is the thing they need. Money is the thing that'll help them get to the next phase. This is the thing that is going to help me do the next thing. This is the thing I've been waiting on. This is the thing that's going to pay my bills. So that appeals. And it shouldn't, but it does, because they already don't have their basic needs. They are in survival mode. So when we're talking about trying to support these groups, supporting these seniors, yes, word of mouth is great. When we did tornado response, you had to go door to door. You're talking about areas of people, the power lines are down. They're not looking at social media. And I'm not saying don't share it. Share and talk. Share and go. When you go to church, if you go to some group, when you're on the bus, whatever it is, even if you don't like to talk, have some resources with you. Ask somebody, can I leave them here for people that may come by and need them? There's so many different ways you can advocate outside of going to those public hearings, but go if you can. Please go. I'm going to make sure that I'm there. But if that's not your thing, then say, I can't be there, but I want to send this letter. Can you give it to someone? Or I have my whole block wants to sign this letter. Can you give it to someone? Those are ways we can move as a collective and share knowledge and put power behind the things that we deserve as a human right.
Again, this is just the first list. We want to embed or inspire or comfort you that we're not done fighting, right? This is only the beginning. I did want to note that the compensation is tax-free. So if one person receives Medicaid, Medicare, they do not have to report this as income, okay? So it is tax-free compensation. I thank you all. Thank you so much for giving
Thank you all.
me the platform and the time. We are doing a church tour. If you know of any congregations that would have us to come in and talk about RECA, any community events, any opportunities where we're able to come in and share this information, we would love. Something's on fire. Oh, okay. I'm sorry. Yeah, but if you guys, we would love to connect. Any opportunity where we can get the word out regarding RECA, we would love it. Thank you all.
Thank you.